Hello. Abalungi mbalamusiza. Greetings to everyone. We are live on Mind, Body and Soul Mental Health Awareness Group. Bambi mutandike okusharinga, tutandike okwogera on suicide prevention. Suicide prevention. We are live on Mind, Body and Soul. Mutandike okusharinga. As you all know, here on Mind, Body and Soul, we are always on time. Tutandikira ddala ku ssaawa 12 ezawano, ate ezibeera essaawa 3 e Uganda. Musharinge, because we are live on Mind, Body and Soul, and our topic this evening is on suicide prevention. Live on Mind, Body and Soul to discuss suicide prevention strategies. Bandange musharinge kuba kino kintu kinene nnyo, topic nene. We have to talk suicide prevention kubanga nga we nabagamba here on Mind, Body and Soul, we try to interpret research for you, to summarizing ebintu ebivudde mu research ne tubibaleetera wano ku Mind, Body and Soul. Share musharinge. Today is a very important topic. Tugenda kuba twogera ku suicide prevention. Suicide prevention is very important. We are live. Hello, admin. I can see you are live. Share. Suicide prevention. Jetugenda okwogerako. We will be talking about suicide prevention. Here on Mind, Body and Soul, we are a team of mental health professionals, and we bring you evidence-based practice. We bring you evidence-based interventions. Tubaleetera ebintu ffe bye tukozesezza nga ba professionals, ate era ebintu research byenoonyerezaako neeraga nti bikola. We do not bring you hearsay. Tubaleetera ebintu ebikoze. Our audios are very short kuba tuba twagala mujjukire bye twogeddeko. So here on Mind, Body and Soul, we bring you evidence-based interventions. We bring you research. We summarize it for you as members of the public to be able to understand research. So this evening, we've got a hot topic. This hot topic is on suicide prevention. Suicide prevention in young people, suicide prevention in adults, suicide prevention in public population. Musharinge kubanga tubawa akabanga katono nnyo era twogera ku bintu bitono so you can remember what we are talking about. So share with your friends, call your friends. We need to talk suicide. This evening, I really want to give a shout out to a lovely lady, also my quality matron, Kath Barrows, who has supported and followed me throughout my career and my passion to work on mental health awareness. So I would like to greet Kath Barrows and welcome you this evening. She's always watching me. She's my boss in work and she's a lovely lady. Thank you very much. A shout out to everyone who wished me happy birthday, because Friday was my birthday, and I would like to thank you all who wished me a happy birthday. Kakati, it's about time. It's 6 o'clock, and we are going to talk suicide prevention. Suicide is a very, very serious topic to talk about. It's been a hot topic in most high-income countries, low-income countries, middle-income countries. Remember, when we are talking public health, we are not calling countries third world countries anymore. They are either middle-income countries, high-income countries, or low-income countries. So suicide prevention has been a massive topic, And the reason is because there's an increase in completed suicide in global health research. So statistics is showing from global health that there is an increase in completed suicide. So there is attempted suicide and completed suicide. Attempted suicide bebantu abagezaako okwetuga n'atafa. Naye ng'agezezaako, so they try but they do not succeed. That is attempted suicide. And then completed suicide is when it becomes fatal and somebody passes away, unfortunately. So the research is now showing that there is an increase in the number of completed suicide. But what is also overwhelming or really worrying and concerning is that in America, suicide is the 8th killer, but actually it is in between the age of 10 to 29. Here in UK, it's talking about the age 15 to 29. In low-income countries, statistics is also showing that there is an increased suicide rate in men of a younger age, of a youthful age, between the age of 20 to 35. Therefore, this is a major problem in developing countries and low-income countries. But what we need to understand, olunaku olwaleero, why do people commit suicide? What are the reasons as to why people commit suicide? Because what we don't want to fall suit in, what we don't want people to think, abantu abamu, I know there's a few of my Ugandan people there. Abantu abamu balowooza nti abantu beekoza. There's a question there. Suicide is the second leading cause of death in young people. And that is from Ivan. Absolutely true. It's the second leading cause of death in young people. Because most young people are not likely to die of a chronic illness. So it is absolutely true. What are the causes of suicide? That's what I was going on to. Biki ebireetera abantu to commit suicide? There is a few areas that have been identified. For somebody to commit suicide, they must truly hate themselves. Baba tebayagala. They must be drowned in sorrow. And that is depression. People who commit suicide are severely depressed. And the evidence shows that people who are committing suicide are not doing it for the first time. Baba bagezezako. They have tried a number of times and they might have failed, which we call attempted suicide. It's very rare for somebody to try suicide and they complete it for the very first time. There is some research on people who are very impulsive. Waliwo ekintu kye bayita impulsivity. Ng'omuntu yakola bukozi ekintu nga takirowoozezaako. Just like that. There is a few of those where people commit suicide due to impulsivity. However, we've got depression, the major cause of suicide. These days, children as young as 6 are being diagnosed with depression. In low-income countries, it's like, due to war, due to poverty, due to problems in families. Children as young as 8 are depressed due to abuse, physical, psychological abuse, sexual abuse. I've spoken about abuse on my YouTube video, types of abuse. Children suffer abuse. By the time they're at a teenage age, they cannot contain it anymore. They start to self-harm. Because most people who commit suicide will have attempted self-harm. As I said before, evidence shows that most people who commit suicide will have tried it before because they will investigate about it. So depression is a big thing. Psychosis. Last week, if you remember, I had a psychologist, Rachel Lester, and she was talking about living with voices. Psychosis, when somebody loses contact with reality, they are hearing voices, they are hallucinating, auditory hallucinations, visual hallucinations. They are seeing things. Bayina ebintu bye balaba, bawulira amaloboozi amabi ennyo, beetakula, bawulira ebintu ebitaliiwo. it can be very discomforting for somebody to go through that. The other issue is harmful use of alcohol and drugs. Children who are very young as 10 years, are trying to drink alcohol, to use drugs. There's a lot of drug culture, both in low-income countries and middle-income countries and high-income countries. We've got a topic coming up on illicit drugs and substance abuse. There's loads and loads of substances being used by children these days, all the way from heroin, cocaine, ecstasy, amphetamines, legal highs, different types of medications being used. Abalungi ebidagala bingi abaana ennaku zino bye bagezaako okukozesa. Naye nga babeera abamu baba babagezaako, abamu bannaabwe baba misadvising nti wonookozesa ekidagala kino ojja kufuna essanyu, ojja kukola bwoti, ojja kukola bwoti, and they try. And in the long run, they get addicted to substances. Harmful use of alcohol. My dear friends, alcohol is a depressor. You drink alcohol, and by the time you wake up in the morning, abamu kituyita hangover, your mood is lower than where you started. So you're at a worse situation than when you started. So if you've got a predisposition to mental health, nonywa omwenge, you are going to feel worse than you started off. And most people tend to commit suicide when they are intoxicated. Ng'ebiri kunsita kyabimanyi. N'akola ki? Ne yeetuga. Committing a suicide during that moment in time. Ebintu ebirala ebireetera abantu committing a suicide. There is things like impulsivity, frustration in children, personality disorder. All the symptoms of personality disorder, half of the time, lead to self-harming behavior. Some of the time, lead to suicide. These people actually do not mean to commit suicide, but sometimes it's an accidental death. N'amaliriza nga yeetuze, ng'ate abadde tayagala kwetuga. Okiraba ekyo. Ebintu ebirala ebisobola causing suicide in people. There's a lot of stigma about mental illness. People don't want to talk about mental health. We don't want to acknowledge that a member of public, a friend or family or relative, alina obulwadde oba yatabuse omutwe. Because we don't talk about it, people are suffering in silence, and they cannot talk about the symptoms they are having. So due to stigmatization, abantu bafa nga tebandifudde. The media out there, how do we handle a situation when somebody's committed suicide? Now, I've got a few Ugandans on here, and I'm absolutely sure half of you know the news called Agataliko Nfuufu. Kati olumu Agataliko Nfuufu gakwata omuntu nga abadde yeetuze, ng'akyalengejja ne ku muti, and they show that to the world. So what's the world going to think about mental illness? We need to start talking about these symptoms, because mental illness is not a myth. It's not a good feeling to be unwell. And I must tell you that depression presents in different ways. Some depression is circumstantial. Omuntu ayinza okuyita mu kizibu, divorce, loss, separation, bullying in school, now ending up ngali depressed. But we must also understand that some symptoms are biological due to chemical imbalance in the brain. And while a circumstantial sort of depression can be dealt with by a humanistic approach, where osobola okwogera n'emikwano gyo, or you can deal with it in a different way, a biological sort of depression caused by a chemical imbalance in the body, you might have to go medical. These days, people do not want to talk about medication in mental illness. Bagamba, do not give them medication. They don't need medication. But sometimes the person is so depressed and they need medical interventions to lift them up before they start talking about their problem. Let's not dismiss the medical model. Let's work together. Psychopharmacological approach, evidence-based, NICE guidelines, the National Institute of Clinical Excellence, producing a NICE guidelines, etugamba nti tukozese a psychopharmacological approach to care for mental health. Those are the causes of suicide in people. Young people are getting depressed at the age of 10. Are they being bullied in school? What is going on? Do they have a learning disability? Some research shows that children who are lower achievers in schools are actually struggling, because can you imagine a child being told to stand up and read a book or a text in a book and they cannot read it and the whole class laughs at them? So we need to start talking about these things. We need to talk to people who understand these things, because sometimes what we do, the people we open up about a situation to, might either make it worse or better. There's some research that came out last week. It's for a PhD student in Lancashire University. And he was looking at the attitude of professionals to self-harmers and suicide. And all the evidence showed that us, professionals, we actually make it worse. We stigmatize suicide. We stigmatize self-harm. It showed that, we put people in observations. You observe them through, you don't engage with them, you don't try to help them make sense of their problem. And this is all the evidence that is showing that even us who have gone to school to study mental health professionals, we still stigmatize suicide. So this evening, we need to talk about some strategies that we need to use to prevent suicide, because suicide is preventable. The evidence shows suicide is preventable. There is some cases, however, where it's not preventable and it happens. You do everything and it still happens. But we've got the Global Suicide Prevention Strategy. The Global Suicide Prevention Strategy must have started around 2013 to 2020. The Global Suicide Prevention Strategy highlighted two things. Ekimukwecho is a public health approach. A public health approach means a national approach. Government etuyambye etya to prevent suicide. Abamumanyi ogamba government etuyambe. That's for my Ugandan people. How does the government help to prevent suicide? These are the public health approaches to suicide. Then we've got the humanistic approach to suicide, where the community and us as human beings can help each other to prevent suicide. So the government strategies have highlighted a few things that are actually being used in high-income countries and some middle-income countries. We've not got there yet in low-income countries. I've got a journalist here who is doing a bit of research. I think he's using, I don't know if he's using Google, but definitely getting the points right. That's Ivan. Definitely, 5,000 to 1,500 die of suicide every year. And I can tell you that one person dies every 40 seconds. My apologies. Every 40 seconds in the world, somebody dies of suicide. So you're right on that. I was just talking about public health strategies. How can the governments help us? Governments need to devise policies that can restrict some equipments or some substances and chemicals being used to commit suicide. So, for example, in high-income countries, I've also seen it in Kigali in East Africa, Rwanda. It's very clear that a child under the age of 18 cannot buy alcohol. And it's posted everywhere in shops. However, in some low-income countries, ojja kusanga nti n'omwana w'emyaka 9, Ugandans who are here, maama asobola omutuma walagi ku dduuka n'amuleeta. A child of 9 years in a country like where I come from can actually be sent to buy alcohol or medication, and they'll bring it to their parents. Kati, we all know that in a country like UK, professionals will know that paracetamol or Panadol is one of those tablets that is not restricted highly, but it's a major killer, because once you take an overdose of paracetamol, that is your liver shattered badly. And we know that in high-income countries, there's a restriction on paracetamol, so you cannot buy more than 2 packets or more than 1 packet at a certain time. So if somebody goes to buy paracetamol, ngayagala jikosanga overdose, they will have to go around different shops to be able to get enough to commit suicide. But in low-income countries, you can buy thousands of tablets without anyone restricting you from getting those tablets. In terms of harmful use of alcohol, as I said, alcohol is a depressor. There's some sort of an encouragement for addiction, because people can buy as much alcohol as they can at a certain age, even children, and nobody will do anything about that. There's no restriction on movements of drugs and selling drugs, sometimes in some low-income countries, which is also a big problem. So the other thing that governments have to do is to put some policies and procedures in place, and these procedures for suicide awareness, suicide prevention, suicide awareness. These are groups, these are things that will stop stigmatization of suicide, stamping out stigma forums where people can openly talk about suicide and self-harm. People can openly talk about how they feel. Media people out there, you need to start understanding the concept of mental health. You need to start understanding the biological causes of mental health. We cannot look at mental health as being weak. We can't look at suicide as somebody taking the easy way out, because while that person is dead, they leave behind families, friends, and other people who have found them mourning. Sometimes when you find somebody who's committed suicide, you might never forget that. It might affect your mental health as well. So the media out there, how do you talk about suicide? How do you talk about mental health? That's a big thing. The government can't do a lot of things on its own. The government needs the population, and we are the population. So we deal with the humanistic approach. Because it's a humanistic approach. A human being needs to be loved, needs to be cared for, needs warmth, needs happiness. So as the members of the population, abantu ba bulijjo, omuntu ayina depression, omuntu ayina psychosis, how do we support them? How do we deal with them? How do we treat them? I've heard of situations where people say, yali yekozesa nti mulwadde wa mutwe yesuula eddalu. You need to understand the underlying causes of somebody presenting that way. By the time somebody comes out to attempt suicide, they must have gone through so much. However, I did highlight at the beginning that there are some issues which do not take very long. So it could be somebody who suffers with a personality disorder and they're quite impulsive. They don't really think about it. They do not wait out. They do not rationalize it, and they just get up and do it because somebody's upset them, because a loved one has left them, because they're going through a divorce. They might not think about it because of the impulsivity of the situation. Some young people with learning disabilities, they could be going through really difficult situations at school. So children with learning disabilities, some of them are put in special schools so they can relate to the children that they're with, the children that they can understand their situations. But some children are left in independent schools because they're on a lower spectrum. It's very common with autism because autism is on a spectrum. So some kids are severe and some people are within a spectrum where they can function independently. So children like this, if they are struggling in school, babera n'obuzibu kubanga bebatudde nabo mu class cannot make sense of their problem. So you find that while they are struggling with reading, while they are struggling with achieving to the same level with the other students could be laughing at them, could be bullying them. We've had a few situations here of children very young committing suicide. I will not be highlighting cases, but people who are here from the Black and ethnic minority community in Liverpool, our children here who have committed suicide. We've had people jump off buildings in London. We've had people, jumping into the train, committing suicide. But we need to remember that in fact, one person who jumped into a train had been on a night out with friends, then very early in the morning jumped in front of a train. And every friend kept saying, "Oh, she was with me yesterday. She didn't say a thing." But she went out drinking with these friends. She could have had underlying depression, used alcohol, which is harmful use of alcohol. People can drink alcohol, but if you're drinking alcohol and feeling low in mood after drinking alcohol, please don't try. Leave it. It's not for you. In the long run, ogenda kumaliriza, you've suffered severe depression. So we need to think about situations like this. So, today we've talked about causes of suicide. We've talked about a humanistic approach to suicide prevention and a government approach to suicide prevention. The most important thing about the humanistic approach is trying to support people who come out and say that they are depressed about something. Give them forum. Do not be judgmental. Listen. Sometimes they just need somebody to listen to them. My biggest stressor is, please do not discredit medication. Do not discredit medication. Sometimes somebody's gone through so much in life for so many years that they need a serotonin reactivator to just raise their mood. Serotonin, I just simply call it the happy hormone. Some people are born with low serotonin levels, and biologically they've got a predisposition to depression. And they might need a serotonin reactivator to make them feel better. Don't go out there and say, don't take medication. You don't need it. Please sometimes give medication a chance. It does not have to be for life, but at least to treat the acute symptoms of not sleeping, not eating, feeling tearful, feeling low in mood. Bannange omuntu wabanga amaze nakutalya teyeebaka, akaabakaaba, awulira yeekyaye, olumu okwogera naye si kye kiyamba. Muwe chance eddagala, mutwale mu musawo, omusawo amutunuleko, amuwe eddagala. eddagala eryo liyinza okuba nga si lya for life naye nga limuyamba mu kaseera ako ate mood ye erifting alyoka atandike some sort of therapy esobola okumuyamba okubeerawo mu ssanyu. Remember guys, suicide is preventable. We just need to change the public approach to suicide. Thank you very much for supporting Mind, Body and Soul. Again, Mind, Body and Soul, we are mental health professionals who come to summarize public health statistics, to talk about mental health problems. Atera, if there's any Ugandans out there, nga muyina ekizibu nga kikwatagana ku mental health, approach me. Nze Musawo Justine Kigozi, ndi confidential. I will support you. Musobola okuncontactinga nenyamba wensobola okuyamba. Some people have contacted me, but if you're out there, do not struggle on your own. We are here to support you. We are here to help you. We're here to be with you. We need to forget this old thing, ways of people are not confidential. They will make a live video out of my life. That's not how we do it. Here on Mind, Body and Soul, we are professionals with PIN numbers. We are professionals with a career, and confidentiality is part of the NMC Code of Conduct. So, temugenda kutubuulira kintu ate tugende tukyogere ewabbali. Tugende tubakolemu videos. No. We come here to give you evidence-based practice, and we help you make sense of public health statistics as again a mass. So parents out there, be aware that children can get depressed as early as 10 years. Look out for the symptoms. Talk to your children. Engage them. Find out how school is going. Get to know their friends. Get to know what they're doing. Most importantly, do not be the one who introduces your child to alcohol. Let them find it by themselves. Don't find it for them. Ladies and gentlemen, thank you for watching Mind, Body and Soul. Thank you for supporting us. We will be here on a weekly basis, once every weekend, Saturday or Sunday, as our administrator will advise. We choose topics according to what is out there in research and what is available and any questions that are being asked. Thank you for watching today, and keep supporting Mind, Body and Soul. Follow us on Twitter. We've got a Twitter page, Mind, Body and Soul. We've got a website, Mind, Body and Soul, and we've got YouTube videos, Mind, Body and Soul by Musawo Justine Kigozi. Thank you very much, all you. I can see a lot of NHS staff. I can see people from Uganda. Thank you very much once again, and have a lovely week. Think suicide prevention, because suicide is a very hot topic and it is happening to both adults and children. We can prevent suicide together. Thank you.